Chemotherapy, exploring its types and mechanisms. Welcome to our podcast, where today we delve into the world of chemotherapy, exploring its various types and the mechanisms behind this cornerstone of cancer treatment. Let us begin by understanding what chemotherapy truly is. Chemotherapy refers to the use of potent chemical agents designed to destroy or inhibit the growth of cells that divide rapidly, with a primary focus on malignant cells. Unlike treatments that target specific areas, such as surgery or radiation, most chemotherapy drugs are systemic. This means they circulate throughout the body, seeking out cancer cells that may have spread to distant organs and tissues. The guiding principle of chemotherapy is to take advantage of how quickly cancer cells divide. However, this same approach leads to some of the most common side effects, as these drugs also affect healthy cells that naturally divide at a fast pace, including those found in the bone marrow, digestive tract, and hair follicles. Now, let us turn our attention to the mechanisms through which chemotherapy drugs operate. These medications work by interfering with specific stages of the cell cycle. The cell cycle is the process through which cells grow, replicate their genetic material, and divide. Chemotherapy agents are often classified based on their method of action and the phase of the cell cycle they target. First, we have drugs known as cell cycle phase-specific agents. These medicines are most effective when a cell is in a particular stage of its cycle, such as the synthesis phase or the mitosis phase. Antimetabolites, which act during the synthesis phase, mimic essential building blocks required for the creation of genetic material. When these substitutes are incorporated into a cell's DNA or RNA, they introduce errors that ultimately stop the cell from reproducing. Some well-known examples include methotrexate, fluorouracil, capecitabine, gemcitabine, and cytarabine. Topoisomerase inhibitors also act during the synthesis phase. They target enzymes called topoisomerases, which are essential for unwinding DNA as cells prepare to replicate or transcribe genetic material. By shutting down these enzymes, topoisomerase inhibitors cause breaks in the DNA, leading to cell death. These drugs are divided into two main categories, those targeting topoisomerase 1 and those targeting topoisomerase 2. Notable examples are irinotecan, topotecan, etoposide, and tiniposide. Mitotic spindle inhibitors, active during the mitosis phase, prevent the proper formation or function of the spindle apparatus. This apparatus is vital for separating chromosomes during cell division. By halting the process, these drugs effectively stop cancer cells from multiplying. Vinca alkaloids, such as vincristine, vinblastine, and vinorelbine, prevent spindle formation, whereas the taxanes, including paclitaxel and docetaxel, hinder spindle disassembly. Next, let us discuss cell cycle phase nonspecific agents. These medications are capable of working at any point in the cell cycle, including when a cell is in the resting phase. Nevertheless, they still tend to be more effective against cells that are actively dividing. Alkylating agents are among the most widely used chemotherapy drugs. They work by attaching an alkyl group to DNA, causing significant damage and cross-linking strands of genetic material. This action ultimately triggers cell death. Some commonly used examples include cyclophosphamide, cisplatin, carboplatin, oxaliplatin, chlorambucil, melphalan, temozolomide, and ifosfamide. Anti-tumor antibiotics, despite their name, are not used to treat infections. Instead, they are derived from microbial organisms and work by various mechanisms. Most notably, they insert themselves into DNA strands, generate free radicals that break DNA, and inhibit enzymes involved in DNA replication. Among their ranks are doxorubicin, daunorubicin, epirubicin, bleomycin, mitomycin C, and actinomycin D. Beyond these traditional classes, there are other therapies that sometimes work alongside chemotherapy. Targeted therapies are designed to home in on specific molecules involved in cancer growth and progression, such as certain proteins or genes. Examples include imatinib and trastuzumab. Hormone therapy is used for cancers sensitive to hormones, such as breast or prostate cancer, and works either by blocking hormone production or by interfering with hormone actions. Examples include tamoxifen and aromatase inhibitors. Differentiating agents encourage cancer cells to mature into benign, non-dividing forms, as is the case with all trans-retinoic acid used to treat acute promyelocytic leukemia. The goals of chemotherapy are varied and depend on each patient's situation. Sometimes, chemotherapy is intended to cure cancer entirely, as seen in some leukemias, lymphomas, and cases of testicular cancer. In other cases, it may be given after a primary treatment, such as surgery, to destroy remaining microscopic cancer cells and reduce the chance of recurrence. Alternatively, chemotherapy may be administered before a primary treatment to shrink a tumor, making surgical removal easier. In situations where a cure is not feasible, chemotherapy can be used to relieve symptoms, shrink tumors that cause pain or pressure, and improve the patient's quality of life. In summary, chemotherapy remains a foundational treatment for many cancers. Its drugs are categorized according to the way they act on the cell cycle, with key classes including alkylating agents, antimetabolites, anti-tumor antibiotics, topoisomerase inhibitors, and mitotic spindle inhibitors. While chemotherapy is highly effective, its lack of selectivity for cancer cells alone results in significant side effects, fueling ongoing research into more targeted and personalized approaches to cancer therapy. Thank you for joining today's podcast discussion. Stay tuned for more in-depth explorations of medical science and patient care. It's the Everything Surgery Podcast. Dissect the extraordinary.